Attending today's press conference for Tuesday, May 19th. Some exciting news has come about in the last couple of days, which actually started with a call on Sunday announcing where we were going to be and how the tide has shifted for Western New York. So today, as many of you know, I'm happy to announce that the Western New York region has, including Chautauqua County, has now moved into a Phase 1 reopening. Governor Cuomo announced yesterday that following a closer look at our region and the statistics from all 5 counties have now met the criteria to open in Phase 1. Coming into Monday morning, we were tasked, the control room, to come up with contact tracers. And I would like to say thank you to all of the leaders in all 5 counties in the city of Jamestown, city of Buffalo as well, that brought the contact tracing information to the governor and enabled us. We needed 521 contact tracers as a rolling metric as presented by Johns Hopkins, and we met with 525. So that was a great challenge for all, and it was met, and it shows the dedication and hard work of everyone in Chautauqua County. So again, we've met all 7 metrics. What does that mean? Okay, but it's important to go through what Phase 1 means as we begin to open. There are only specific businesses and industries that may open. Some may have restrictions, and all must continue to adhere to social distancing policies and other disease prevention measures that have been laid out. The partial opening includes the following industry: construction, agriculture, forestry, fishing, and hunting; retail, limited to curbside pickup or in-store pickup; manufacturing; wholesale trades; and all previous designated essential businesses, including grocery and delivery or takeout food services. You'll also note that many businesses and trades are not reopening in Phase 1, and a general list of those not allowed to open at this time are the following. In Phase 2, professional services, including beauty salons, and I know many people are eager to get into their salon or barbershop; in-store retail, administrative support, real estate, rental, and leasing. Those are all Phase 2, and they are not open yet. Phase 3 are restaurants and food services for on-site dining. And lastly, Phase 4, arts, entertainment, recreation, and education. Again, I'd urge everyone, and we'll discuss this throughout the press conference, that your adherence to the social distancing, the wearing of your mask in public, or when you're visiting these businesses, or if you are an employee, adhering to your employer's plan for reopening. We do not want to make a backslide, as the term is used, and revert back to a pause. So your decisions are critical not only to the health and safety of the residents, but also the health and safety of small businesses here in Western New York that are eager for this opening to take place. At this time, I want to turn the microphone over to the Deputy County Executive for Economic Development, also our Executive Director for the Chautauqua County Industrial Development Agency, Mark Geis, to provide information on the requirements for reopening under Phase 1 and resources for businesses to prepare for the reopening under phases. Mark.
Thank you, PJ. Well, first of all, I want to say today is a great day. You know, it has felt like there's been a black cloud over our economy for months, and the sun has finally come out. So I want to celebrate all of the hard work, commend all the hard work by especially our county executive, PJ Wendell, and his leadership, and also Christine Schuyler for staying on top of all of this. So congratulations, you guys have done a great job. So I was asked to talk a little bit about what's required by the Phase 1 businesses to reopen, and talk about especially the New York Forward website. First of all, the website address is forward.ny.gov. And if you go to that website, there's really three templates per sector that PJ talked about in Phase 1. So these 3 templates are summary guidelines, detailed guidelines, and business safety, and a business safety template. The summary guidelines is really guidance from OSHA and the CDC, basically pertains to all of the sectors, and it's broken down by physical distancing, protective equipment, hygiene and cleaning, communications, and screening and testing. So that's a wealth of information. There's also a template. There's also a guidance in there for it's called detailed guidelines, and that is broken down more by sector. And that requires that, again, it's broken down with those same categories: physical distancing, protective equipment, hygiene and cleaning, communication, screening, and testing, and also requires that the business certify that they've read and understand and will comply with those guidelines. And that's an electronic signature that gets sent back to the state. The third document within that website for each sector is called the Business Safety Template, and that requires that the businesses go on, fill out this form. It's a couple of pages, asks for contact information, what type of business they are, and then certifies at the end of that with an, and then they need to print that out and keep that on hand so that if they're inspected by the Department of Health or any local health department, they have that on hand. So they need to keep that. So that really is, in a nutshell, what is required by the businesses. I also want to point to the Chamber website, chautauquachamber.org, the IDA website, ccida.com. And JCC is also offering training for businesses to develop these templates if they want to go above and beyond what the state requires. And lastly, I just want to say that the IDA has really worked hard through all of this. Our staff has been very busy. I want to commend them. We've developed a working capital loan program. We developed a business PPE grant program and technical assistance in conjunction with JCC, and we've also been a disseminator of information. So with that, I will turn it back to the county executive. Thank you.
Thank you, Mark. As we've continued throughout the COVID-19 crisis, we want to remind everyone that we all need to do our part to prevent and limit the spread of COVID-19. Social distancing and other measures are even more important as we enter phase one reopening. I understand how frustrating it has become to wear a mask, but as we travel, we notice more and more people wearing them. I'm sure it's a little frustrating when you want to bring your coffee cup and you realize you still have your mask on, or you grab some food and realize your mask is there. But we understand these, and we want to remind everyone that what we are doing is working, and we need to continue that. But we must remain strong and continue these practices for several reasons. This is being done, and the reopening has been done thoughtfully and based on metrics, our science and data, as we, from my team, have stated from the very beginning. We are speaking about the data and the science that is being provided to us, not merely our own thoughts or our own philosophies. If we stop social distancing and violate the phase one restrictions, our numbers could increase and put us to a point of what I've said earlier is a backslide or a delay in opening further phases. I want to remind everybody, social distancing and face coverings and other measures are not here to just protect ourselves and our families, but our communities as well. The last thing we want any of us to have happen is for the next phases to be delayed. I know several friends that own beauty salons and other businesses, whether they're gyms and fitness centers, are eagerly awaiting the chance for them to reopen and get back to their normal or the new normal. And we would not want to prohibit them because of the actions of some or those who don't feel what we are doing is working. But it is critical for our local businesses to be able to reopen. Just one quick example, and we've been given permission to express this story. We've received several messages over the last 3 weeks from somebody I've grown to know quite well over my career in teaching, is Penny Eckerd, an owner of Penny's Less Family Salon in Falconer. Penny initially reached out to us for clarification when Governor Cuomo closed non-essential businesses, including salons. And as time went on, Penny again reached out on behalf of herself and other local salons and hairstylists, many of whom were having trouble accessing the unemployment system but facing problems in and of their own financing. As time has further gone on, Penny has yet to receive any assistance and is concerned as to how much longer her salon and others will be able to make it in our reopening. So it's critical that we're able to proceed in the next reopening phases so local business owners like Penny and many others can open up and serve their clients and to become a local income stream again. Our numbers have shown that social distancing, masks, limiting trips, all works and we can't give up now, and all those things we've done in the past have helped. When I called Penny to ask if we could share her story, she agreed and asked that everyone continue to be vigilant because she knows many people want to get that haircut. Although unfortunately I don't have that concern, I do share that with many of my residents. She wants to get back to work and seeing clients as soon as possible. At this time, to talk more about our health concerns and the health statistics, I will turn it over to Christine Schuyler, our Public Health Director, and also in attendance with us, Dr. Robert Burke from my COVID-19 response team. Christine.
Thank you, County Executive Wendell. As we begin to reopen, I urge county residents to continue to pay attention to their personal and community responsibilities. COVID-19 is a highly infectious virus, and as such, we expect to see increased rates of infection when people get out and about more and people are doing more. Please use common sense. Abide by these precautions. Do your part to decrease the spread of COVID-19. The virus is here. It hasn't gone anywhere. We've just done an excellent job of mitigating it as we were directed to do. It's very important that we continue to do so. We fully expect to see increased rates of infection as people are out and about more. So we need to do our best to control that as much as possible. If we see too much of an increase in infection rates or in hospitalization rates, that means that we're going to have to go backwards and things are going to be locked down again. We really don't want to see that happen. I really commend our communities for doing the tremendous job they have so far, but we still must remain vigilant. It's too soon to let our guard down. I ask that you continue to take the measures to help decrease the spread of disease. Wash your hands for at least 20 seconds. If soap and water aren't available, please use alcohol-based hand sanitizer. Face coverings should be worn when out in public and not able to maintain 6 feet of social distancing. It's important to note that children under 2 years of age and those who are not medically able to tolerate a face covering are exempt from this. So you may see someone out in a store who has some underlying health conditions that really makes it impossible for them to wear a face covering. So I think it's critically important that we don't judge others around us without maybe knowing really what's going on there. Please stay home if you're sick. Don't go to work. Don't go to the store. That really is a key element of preventing the spread of many diseases. Call your healthcare provider and talk about your symptoms and take their advice. Only if your symptoms are severe should you call 911 or utilize the emergency medical system. Those people who are over the age of 60 or who have underlying health conditions, including such common things as hypertension, diabetes, chronic lung disease, asthma, obesity, are at higher risk of complications of COVID-19. We have to do the best we can to protect those vulnerable populations. Please clean and disinfect the frequently touched surfaces frequently. Later today, we will update you on any new cases that come about that are reported to us today. As of last night, we have 53 confirmed cases. There was an increase, I think everyone saw over the weekend. I've received several questions about that with 7 new cases over the weekend. And I can tell you that that is a reflection of people who are starting to gather prematurely and not abiding by our social distancing recommendations and requirements. So right there is a testament of how we really still need to be vigilant. COVID-19 infection testing is widely available now. We have testing available at UPMC Chautauqua in Jamestown, also at the Chautauqua Center sites in both Jamestown and Dunkirk. Westfield Memorial Hospital has opened up an alternate testing site at their hospital. Also Well Now facilities in Jamestown, Lakewood, and Dunkirk. There you can also get antibody testing. So far, I can tell you we're only seeing a 2 to 3% positive rate in the antibody tests. So while it's not anything scientific to this yet, we don't really have enough data to say that, but to have that many people not showing antibodies makes us think that really COVID-19 has not been widely spread in our area. So another reason why we think we'll probably see increased rates of infection once we open up. So far, we have given information to the public about positive cases that include the fire battalion, they're located in, and their general age. We don't identify positive cases based on any other identifying facts, and that will continue to be our policy. We urge you to treat all of your neighbors with respect, and I also ask that you treat this virus with respect. Everyone is equally susceptible to contracting it and to spreading it. The virus doesn't discriminate, and neither should we. For those who are trying to get back to work, I'd also like to remind you that childcare is readily available as well in Chautauqua County. I know we have received, as the Department of Health and Human Services, several waivers. So we have been able to increase the eligibility for subsidized childcare. I ask that you please feel free to reach out to a childcare provider or to our Department of Health and Human Services for more information on childcare services. Unlike some of our neighbors, like in Pennsylvania, New York has continued to have daycare centers open for essential workers. So our childcare centers in the county are already have in place policies and procedures to protect parents and children who are in need of childcare services. I know that they're taking temperatures at the door, they're limiting the size of their classrooms, they're wearing masks. We have worked very closely with our childcare council and childcare providers to ensure that the safety of children has been met throughout this pandemic. I think there's also a countywide plan for childcare. So I hope that anyone who is out there and is now going back to work as we reopen in these phases and is in need of childcare, please reach out because it is available in our county.
Thank you.
Thank you.
This time, Dr. Burke, would you like to speak?
Thank you, PJ. I want to just follow up on Christine's comments. I think most of us have seen the scenes elsewhere where people are just flocking to bars and beaches and ignoring good public health advice. And this is just a license to spread this disease. I think we have been very fortunate that our population here has been very well disciplined, and some of the cases that we're seeing are from a lack of discipline and people congregating, and this is the perfect way to screw up this opportunity. We have been given the chance to open up, but as PJ mentioned, some folks are still sitting out there and can't open yet, and they're waiting their turn. And if we are cavalier about how we're congregating, we're going to destroy their opportunity to get a chance to open up again. There's been a constant question, I think, that has been out there as to how long this is going to last. What's going to change? And I think there are a number of possibilities. One, this is miraculously going to go away and we're all going to be good in a couple of months. I think that's highly unlikely. The last pandemic in 1918 had a resurgence, 2 more waves that killed a whole lot more people. So we cannot expect that to happen. The second is that we will, in a very short time, have a vaccine or medication to make us all impervious to this. Again, the predictions are 12 to 18 months. It may be a little sooner, but this is probably not what's going to happen right away. So what are we left with? We're left with what we've been doing: common sense, social distancing, and discipline. And I think that's the only weapon we have as we gather data and begin to understand more how this virus is spread and how we can deal with it. And I think that's where we have to concentrate and be smart about it. It's very simple. All you have to do is look at the standard practices that we have used over the last 3 or 4 months, and it has made us relatively safe here. It is not the time to let our guard down.
Also with us from the Public Health and Safety side, we have our Director of Emergency Services, John Griffith.
Thank you, PJ. The Office of Emergency Services continuing to distribute PPE as needed around the county. If anyone is looking for surgical mask or hand sanitizer, other pieces of PPE, please go to our website, www.chautcofire.org, CHAUTCO fire.org. There's a form on there to fill out and send that in, and we'll try to do everything we can to accommodate your request to get you the PPE and sanitizer that is needed for organizations throughout the county. We continue to provide logistical support to the health department, and we look forward to moving forward as the county begins to open up carefully, of course, as the county executive has stated.
John. One of the things I'd like to echo was a point that was made yesterday in Governor Cuomo's press conference by Dr. Bott. We have now brought online to New York State, two individuals and one in geostatistics out of the Royal Academy in London. And Dr. Bott said exactly what Christine Schuyler had said, is we will see an increase in cases as we begin to open up. So we want everyone to be very cautious in your social distancing, et cetera. We want to do this in a very effective manner, but reminding everybody that, we will see an increase in cases. But it's our ability to mitigate those cases, our ability to contact trace and aggressively get on these cases and take the proper measures to secure the public health and safety of our residents in Chautauqua County. So we'd just like to reiterate that as we move forward. Lastly, but certainly not least, I'd like to turn the microphone over to our Chautauqua County Sheriff, James Quattrone, to give an update regarding the enforcement and other issues that have been going on here in Chautauqua County, and also County Attorney Steve Abdella for any additional clarification. So, Sheriff.
Thank you, Mr. Wendell. I'd start off by saying I don't know anybody that has been enjoying a face mask. However, I would like to applaud all the county residents who have been considerate of others and practice many of the safety factors of social distancing, no mass gatherings, and wearing the face coverings. Ms. Schuyler had mentioned, we can't be judgmental of those who are not wearing them, and likewise, those who are choosing not to wear them should not be judgmental of those who are wearing them. Many of us are choosing to wear them because we are considerate and concerned for our county residents and our neighbors and friends and family. But we need to continue opening our economy in a reasonable and prudent manner. And that's going to require that we all continue to regard our wellness and safety precautions. And if we don't, that they're going to continue to pose an additional threat to our community as a whole. I think of some of these precautions, and this morning I was thinking of my kindergarten teacher and my first grade teachers, Miss Carlberg and Mrs. Henry, and so many who taught some of these proper hygiene, washing our hands and staying away from each other, covering our mouth when we cough. These are things that we need to really continue to practice. But unfortunately, we continue to get complaints, and we will encourage those complaints to come in. But when people are not practicing these precautions, we get more complaints, which takes law enforcement away from the duties that they need to be doing to keep our community safe. However, if you need to file a complaint, the New York State PAWS Enforcement Assistant Task Force is still up and running. That number is 1-833-789-0470, or you can log on to the New York State PAWS website and file those complaints. We will follow up on those between 24 and 48 hours after. And how we are doing that, we are working with local law enforcement across the county, and each jurisdiction is following up on the complaints within their specific areas. We, again, continue to recognize that there will be violations. Our goal is to initially advise, to educate the people, and then encourage compliance. However, there is that risk of being fined, and the state now with the public health laws up to $1,000 fine, and potential closures or rescinding of certain licenses such as the alcohol beverage control and different other certifications. So again, overall, we believe that the community has been doing a great job, and that's witnessed by the low number of cases, and we want to continue that on. Thank you.
Thank you. And our county attorney, Mr. Abdella.
Yeah, I'll just echo what others have said, that, right now we are entering really the most challenging phase because we will have more human interaction as people go back to work, as more businesses are able to open up. It really is a team effort of the community, and that's the best way to view it. not unlike World War II, that's been said before. The way we succeed is by having the entire community get behind this effort so that we can make our way through the phases and get to the light at the end of the tunnel. Thank you.
Yeah, just some clarification that took place prior to our last press conference. As many people have seen and commented that we did extend our state of emergency. But that does not impede us in any way, shape, or form from our phase one opening, nor will it impede us in any forward-moving phases. Part of the Western New York control room that I am sitting on, along with our other local official in Chautauqua County, Mayor Sundquist, we've now been tasked to monitor the numbers for the next 2 weeks. I know some of the businesses are eager to get open, and that's what we're looking for, but our vigilance for the next 2 weeks are critical. And it is just that, it's a challenge. And this is a challenge that I put out to everyone in Western New York, but especially here in Chautauqua County. Where can we go from here? How are we going to answer this challenge? It's been our privilege in the past to lead by example, and many of the initiatives that have happened in New York State and some of the things that have been brought to the governor's attention have come from here in Chautauqua County and Western New York. And it's our compelling arguments and our abilities to work together. As Friday we announced there was a 3-county coalition between Cattaraugus and Allegheny County to ask to be considered as a sub-region. And those requests did make their way to Albany. And it was also part of the governor's reevaluation of the metrics and the situation that these counties pose. So I commend our leadership from Cattaraugus and Allegheny counties and their welcomeness to work together for this effort. And what I've also said in the beginning has been a unity of effort here in Chautauqua County. So I applaud them. Also the steadfastness of County Executive Mark Poloncarz from Erie County in asking the measures to be reevaluated and the data to be looked at. This is a data-driven analysis as we move forward. So again, we need to ask everyone to continue with their vigilance and their efforts. Joining us today is our state senator, George Borrello. So I'd ask him if he'd like to.
Thanks, everybody. You know, I guess everyone else has made certainly very thorough analysis and comments and of what's going on. My overall, I guess, overarching, words of advice are: please practice common sense. We all know it's been a long enough time now. We all understand where we are here, and I think that while there are some people that are very frustrated, others are still very concerned. And I think it's just a matter of common sense more than anything else. For those folks that are at high risk, please stay home or take as many measures as possible to protect yourself and your family. For those of you that wish to go out and whether it's patronizing businesses that may now be open that were not, or even the ones that have been open since day one, please continue to exercise those safety precautions, wearing PPE, doing everything you can to ensure that you're limiting your contact with others and with surfaces that can be infected. But most importantly, please respect one another. There are those folks that are at high risk and that do need to make sure that they are taking all those precautions to protect themselves and their family. For those of you that wish to go out and do other things, just respect everyone else. This is just a common sense, human to human respect for one another, and that will help us get through this safely without a spike in cases, and so that we can continue to safely and carefully move forward into the next phases. So, PJ, thank you very much for inviting me on here, and I'm certainly, if anybody has any questions for me, I'm certainly willing to answer questions as well.
Thank you, Senator. So at this time, we will open the microphone up for questions. We'll go down through our list. We would like to ask everyone, due to our initial time limits, we would like to limit the questions to 3 per person. As time allows, we will offer more questions as time permits. But at this time, we'll start with Dennis Phillips from the Post-Journal.
Thank you, PJ. What businesses would be included under retail curbside pickup and in-store pickup?
Well, I guess it's a good question. Mark, do you have that answer? I apologize.
I may.
Mark's looking at it right now. The belief is now anybody that would be able to offer those curbside pickups. I know several businesses, many of the larger stores have online shopping, and you can use those tools to shop online and then pick them up in stores, which has been a practice that's come about in the last couple of years. But we're looking for definite clarification.
Clothing stores, direct selling establishments, electronics and appliance stores, electronic shopping and mail order houses, furniture and home furnishing stores, florists, general merchandise stores, health and personal care stores, jewelry, luggage, and leather goods stores, lawn and garden equipment and supply stores, office supplies, stationery and gift stores, used merchandise stores, shoe stores, sporting goods, hobby, musical instrument, and bookstores, and other miscellaneous store retailers.
Thank you. Also, Senator Borrello, you had a response?
Yeah, thank you. And I think Mark covered it with the specifics there. Again, I think this goes back to the fact that, in my opinion, this has been, as I've said before, somewhat arbitrary and capricious. You have places like Walmart and other big box stores where we have not seen any flare-ups that I'm aware of in our area that are selling all those products that small business owners have not been able to. We had Mother's Day recently. You could have walked into Walmart and bought flowers, but you couldn't buy it from a local florist. You could walk into Walmart and buy jewelry, but you couldn't buy it from a local jeweler, so on and so forth. And the reason I'm saying that is that the same practices that were occurring at these big box stores will be part of the plans and are part of the plans of our local retailers so that they can safely reopen. And in my opinion, have a much easier, opportunity to control those folks when you only have a handful of people. And again, they're not going inside at this phase, but in future phases they will be able to. Ultimately, the curbside pickup is going to be a challenge for those small retailers because if you're going to buy it online, there's so many other options. So as we move into the future phases, we'll see people being able to return into those stores. But right now, you can go in these big box stores. So ultimately, the curbside will be that specific list that Mark outlined, but I think it's still going to be challenging for those retailers until we get to future phases.
Thank you. Dennis, any other questions?
Yes. Has there been an update on when phase 2 or when other business sectors will be able to start reopening? I know at one point I believe I heard that every 2 weeks a different phase would be able to be open, but if the metrics are still being met, do you expect that there might be a shorter time frame in between opening up the different sectors of businesses?
That hasn't been explicitly expressed. I know we're looking at 2 weeks. That is the information the control room was given yesterday. But with that being said, I urge all of those businesses in phase 2 to please visit the Forward New York website and get your business templates ready. Start to evaluate now. We've been ahead of the curve here in Chautauqua County. A letter I sent out almost 4 weeks ago now asking businesses to begin a plan of reopening. So we should be well capable and ready to make that opening next in 2 weeks as we're given. Trust me, I would be more eagerly excited to share news of opening earlier if that's possible. And, again, we have to give this really good time. The 14-day incubation period is what they've looked at. So we need to keep that in consideration as we move forward. So if things change, and this is a very fluid situation, we will give that information should it change. But for right now, 2 weeks is what we're looking at.
14-day time frame gives us the opportunity to look at increased infection rates. So that's, I think, really where the 14-day time frame has come from.
Dennis, anything else?
Yes, my final question would be, is the county still pushing for the sub-region proposal after opening, just in case there are spikes in other areas of Western New York, let's say Buffalo, after the opening of phase 1, the sub-region plan could still work, and I guess after opening, I guess your thoughts on that.
Well, we are continuing to work the 3 counties. The sub-region plan has been sent to the governor's office in what we would look at and how we would approach that. We still are going to work together. We're waiting to hear if that will be necessary. Right now, I believe the efforts we've shown as a region have been holding fast. So again, if that situation occurs, we are going to continue those collaborations and hopefully use that as in the future as for a definite distinction of a sub-region that has not been expressed to us now, but that is still there and on the table in the governor's office.
Thank you very much.
Moving on, WDOE, Dave Rowley.
Good morning. First off, any idea how many businesses has the county IDA, have you assisted as far as trying to develop plans for reopening?
Well, we sent those templates out actually the day before the state released their templates. So we sent it out to over 500 businesses. So it's hard to say how many of those businesses actually have the plans, developed or had the plans developed prior to the state releasing their guidelines. So it's hard to say, but we did work with dozens of companies to help us develop those plans. A lot of the essential businesses already had plans in place. And so, I don't have an exact number, but a fair share.
Okay. And just to follow up, at this point, should folks who would face phase 2, phase 3, and phase 4, should they be working on their plans at this point?
Most certainly, and that's one of the things that we spoke in our control room. Lieutenant Governor Hochul spoke yesterday is, getting the information. So the first group is ready to go. The first team in the game is ready to go now, and then the second group of starters is going to get ready, our phase 2 people. So yes, we ask everyone on phase 2, 3, and 4 to begin, formulating those plans, getting online, electronically filing those, or electronically signing those so the state has record, and moving forward.
Okay, and just one other question. We hear about backsliding. It's something we don't want to hear about at this point, but if we do see the infection rate starting to climb, is there a plan how to address that, how to adjust?
Yes, there is, and that we're going to be looking at that in our control room. We don't know exactly the measures and the plan. There's a plan in place. We will, as the governor has said, he's mentioned turning the faucet or slowing it. We may go back into a pause or a restrictions. Exactly, we're not sure. We're very confident right now that through that social mitigation or social distancing, we'll be able to continue this, but there are plans in effect, and that'll be based on, where the spikes are, what type of spike do we see, and what clusters, yes, if we find any, but also what part are we impacting? Is it the healthcare system? Is it local, spikes, like we said, or clusters, as Christine Schuyler had said? So we'll look at that and evaluate, and depending on where the spike is, depending on where the influx is, we'll make adjustments accordingly.
And part of that, if I may interject, with the hospitalizations, those who are at higher risk for complications are who really ends up in the hospital and very, very ill and requiring advanced treatment. That's another reason why it's so important to protect those vulnerable populations. We don't want to see them hospitalized and fighting for their lives.
Anything else, Dave?
Nope, we're good. Thank you.
Thank you so much. Moving on, Media One Group, Terry Frank.
Yes, good morning, folks. Real quick, had a couple of questions. One that's come up before, but was posed to me yesterday, and that is county services like the Department of Motor Vehicles. Yeah, how soon they'll be reopening.
That we're looking at and evaluating that, but looking at phase 2 and professional services and support services is what we believe that will fall under, or administrative support. So again, we'll keep everybody apprised if those things change. We'll let them know as soon as possible.
A quick question for the medical folks. I know that people have been wearing different masks. Some of them are cloth. I have a cloth one myself and my father. How often should those be cleaned? I'm washing them generally once a week.
I'm not sure there's any data on this that's reliable, because there are so many different kinds of masks out there. The nice thing about the cloth mask is you can just throw it in the washing machine, and that should be done as regularly as possible. Depends how often they're used. It's more common sense. Some of the other masks should be thrown away. They're not suitable to be. Even though in the past, when masks were in short supply, people were using them for extended periods of time out of necessity. They should only be used for a certain amount of time and then disposed of. I want to make one more. On my way over here, I was listening to a conversation about contact tracing, which is dear to the heart of Christine and the work her people are doing. In Los Angeles, they're putting hundreds and hundreds of these contact tracers out there, but they gave an example which describes exactly what we don't want to happen. A person goes to a birthday party coughing. 10 days later, 5 people are sick. And now you have not only the index case, you have 5 people, and you have the 5 to 10 people that each of those 5 people contacted that have to be traced and dealt with. This is how quickly it goes if you don't use your head. And we really have to be careful. This is really a very simple process as long as people use common sense.
Thank you.
All right. Thank you, folks.
Thank you, Terry. And we're gonna skip over Western New York now just because he's here with us, but we'll go to WRFA and Jason Sample.
Yes, good morning, everybody. Thanks for taking that time out and talking with us this morning. I wanted to get back to the contact tracing and just ask Christine Schuyler or Dr. Burke. You mentioned that obviously you're seeing an increased number of infections over the past few days, and I was curious to know, when you do that contact tracing, is that one of the questions you ask, is the people's social habits? Have they admitted to being out in publicly, and is that how you've determined that? I know that some people were confused as to how you were able to determine that an increase in social interaction is what possibly has led to the increased cases, and I just was hoping you could elaborate on that.
Yes, there's a whole laundry list of questions that we ask people, including where they've been and who they've been in close contact with, which is defined as, excuse me, within 6 feet of someone for 10 minutes or more. Guidance from the State Health Department tells us that we should go back 48 hours before symptom onset. So if you are out and about, you better start taking some notes and be prepared to answer all of the questions that we're going to ask you about where you've been and who you've been with and for how long, and were you wearing a mask, and all the precautions that were taken. So, yeah, we're on it.
Thank you. When it comes to the antibody testing, you mentioned 2 to 3% of the antibody tests have only come back positive, so that's a large number that have come back negative, and that's good news. But do you know offhand or a ballpark figure of the number of actual antibody tests that have been conducted in Chautauqua County to date?
Not off the top of my head. I'm somewhere in a ballpark of 500 or 600, but I'd have to add them up to tell you for sure. And we could do that for our update later today.
Very.
Keep in mind the Well Now facilities are the only facilities in our county right now that are offering widespread antibody testing, and we're having a real time lag in getting results from Well Now and the reference lab that they are using. It can be 7 days or more before we're seeing testing results.
All right, thank you. And I really appreciate, I think everybody appreciates the information that's coming out on a daily basis when it comes to the updates of the number of cases and the number of those who are in quarantine. One of the questions that have come up is the number of people who are hospitalized, and I know that number is low, and sometimes there isn't even a number for that, but could you explain why the hospitalization rates are not being included in the daily updates, and if that's going to change anytime soon, since it's part of the metrics being measured for the entire region?
To the point, we could include those on our daily updates, but right now we haven't had the hospitalizations. I believe today we have 1 hospitalization, and we look back to, I've referenced this in several occasions, back to April 8th. So from April 8th until May 19th, we have had 3 hospitalizations in Chautauqua County. So it's very significant when we look at the metric moving forward as to how we're handling this. We could put the information out, but the other side of it is, the public, really can't have any control over, our hospitalization rates. What we do control is the social mitigation, wearing our mask, and continuing what we're doing. We can get that information out to the total hospitalizations as we move forward. But again, reminding everybody that the way we can control this from a community standpoint are wearing our masks and the social distancing policies and practices we've been adhering to so far.
And some of that, Jason, if I may, is I'd like to clarify with the State Health Department exactly how that metrics is being calculated. I think that was some of the issue, because sometimes you go by county of residence, like for our positive cases or negative, it's, we could have somebody that their home address is in Chautauqua County and they volunteered to go out to New York City and help out develop COVID-19 there and never ever come back here. They recuperate and go back to work in New York City, but they count against us as a positive because they're a county resident. And as far as the hospitalizations go, I'm not exactly sure, and I think that was some of our issues in counting the hospitalization rates between Chautauqua County hospitals or Cattaraugus County Hospital or Erie County, New York, or Pennsylvania. And when we cross our state line, even though it's so close to us on many sides here, there are different reporting issues and mechanisms that go on between states. So it's a little complicated.
Seems that way. Thank you all again very much for taking time out. We do appreciate it.
Thank you, Jason. And last but certainly not least, here with us is Justin Gould from WNY News Now.
In regards to Chautauqua County's tourism season, which is a huge economic driver, what's the pulse of that right now? And if we don't have it because of COVID-19 concerns and the reopening phases, what will that outlook look like economically here?
Well, the economic outlook would be very scary, very bleak. We need to utilize our tourism. If you look outside today, the sun is shining and we are creeping up toward the end of May. But that's a good point, Justin, and a good thing to remember that, again, if we don't follow this social distancing, potentially if we're looking at a 2-week window for each phase, in 6 weeks, we could be looking at a much broader opening of Chautauqua County. That's if things go well, if we continue to follow these rules. And to your point, and this is something we want to drive home to everybody, if we don't follow the social distancing, if we don't practice our wearing our masks and doing the things we're supposed to in each of these phases, we could jeopardize that tourism industry as we move forward. So those are things that we need everybody to consider. Very disappointing news was made last night that the Chautauqua County Fair has been canceled. So again, that's another economic engine for our 4-H. And I know several of my former students from my classrooms at Falconer have done a great job raising animals, and they're going to continue. And hopefully we have some really creative ways to think outside of the box for those livestock sales. But having said that, if we do not heed or step up to the challenge and continue the hard work we've done now, that summer season could be in jeopardy. And I spoke to Danny during the week. I don't think I've ever had my summer canceled in 49 years. So I would hope that doesn't happen this year. So we need everyone to continue the vigilance, keep up the good work with social distancing, and make sure we're able to get some sort of a summer out of this.
And in regards to the reopening, Executive Wendell, your idea of having a sub-region, is that something that if, say, the Buffalo area, which has a lot different metrics and lifestyle than people here do in regards to separation, starts to go back down as they reopen, would that be a tool that you would petition to say, hey, Chautauqua, Cattaraugus, Allegheny, we are different, please make us separate?
Certainly, we put that in front of the governor's task force and into the governor's office as well. So they're aware of this, and we're gonna stay with that. We're not abandoning that. But as we move forward in this reopening plan in phase 1, we're moving as a region. We would again, if things start to slip and we see that there's an increased caseload in Erie County, and we are staying flat or going in a positive direction, then yes, of course, we need to be considered. And our economic engine is really was another good compelling argument when we brought the sub-regional approach. We do border Pennsylvania on 2 sides, and as we saw yesterday, state of Ohio was open for patio dining. And if the governor said people will drive 2.5 hours from the city to get Thai food in Albany, I am sure there will be people from Chautauqua County driving to Ohio to sit out on a patio and have dinner as well. So great opportunities.
And in regards to that new normal, kind of, what do you tell businesses who are in phase one, probably going to reopen maybe this weekend or whenever they're comfortable to do so? What advice do you give to those who are deciding, saying now, okay, I'm going to reopen, but I'm going to do X, Y, and Z?
Well, as long as they're maintaining or following the protocols, we encourage that. If people want to take extra protocols, then we remind all those customers that adhere to those. That it may be something a little bit more than what's required, but again, this is being left up to the businesses themselves. And I think that's what's a unique piece to this, is we're putting the ball in their court. We're letting the businesses do exactly what they're able to do. A minimum is what's being put out there, but if anyone wants to do more, we certainly encourage that. And we, again, going back to what the sheriff said, is you need to respect the businesses. They're doing what they believe is the right thing for, their business. So if that's something that you walk in and you think it's too stringent or it's something, you don't need to argue. We can just say fine and step away or, go somewhere else. But again, we want to respect everybody and what they're doing. They're doing what they feel is right for their business. And we encourage people to, use that metric and to do what they feel is appropriate.
Now, in regards to the enforcement of it, if there is a business who reopens and they don't do anything different, what's the best way for us to police that?
Turn that over to the sheriff.
As I had mentioned earlier, there's a New York State pause where you can file complaints. If somebody feels comfortable enough in talking to the business manager, they can do that. There are many of the businesses that I've been in over the last several weeks have signs on the doors advising to wear masks. Again, we're just asking people to do that. The stores have every right to do that, and once they put those signs on the door, if somebody chooses not to do that and the store wants to enforce it, there could also be trespassing charges.
Yeah, and would your deputies and other police agencies, they'd respond to that and possibly cite someone and have them leave the premises then?
If the business desires to have somebody charged or removed for trespassing, yes.
Okay.
Because we're coming in to Memorial Day weekend, in Chautauqua County, campgrounds are open. They are permitted to be open, and that includes for temporary camping. But we are enforcing all the social distancing requirements. There's no common areas open, no playgrounds, no concession stands, no contact sports, anything like that. But we realize the importance of people being able to get their campers out or their tents out and having their own campsite, which will be spaced apart more than normal, and enjoying their own time out in the fresh air and in the open. Any questions on that, you can call our environmental health unit on campground requirements this year.
And then my final question could be for Christine or Dr. Burke, whoever wants to answer. With childcare still being essential and being open, now we've seen some summer camps, the Girl Scouts of Western New York, one of the biggest ones, deciding to not hold that. That was a great resource for parents to be able to have a steady childcare for their children. In regards to health and safety of these child care facilities, how is that monitored, and what relief would you offer to parents who are concerned?
Child care centers are actually licensed by the State Office of Children and Family Services, so they are monitored and do have much more stricter guidelines that they have to follow. And they have the ability to decrease the class sizes so we don't have so many kids together. Children's camps are kind of a different issue. You tend to have a lot more kids together, especially if you have an overnight camp. We have not received any guidance yet from the State Health Department as to the future of children's camps this summer. Those who have already decided to not hold their summer camps are doing that of their own accord. We don't really have any good direction on that yet from the state. We do permit them on behalf of New York State as far as public health.
Thank you.
Right. I'd like to thank everybody. And at this point, I'd like to issue the challenge to the residents of Chautauqua County. We've been asked to step up and give contact tracing, and we were able to do that. We've been asked to socially distance ourselves to help flatten the curve, and we've done that. So now the challenge is, can we continue with these efforts? And now to begin phase one and look forward to our residents that have phase two businesses and supporting them in phase three and ultimately phase four. The challenge is up to us. It's up to the residents. How well can we manage this situation? That's what I'm asking. And I know the residents of Chautauqua County have done a great job so far and will continue to look out for the health and safety of our residents and now our businesses. We're looking at our economy, and we need to get back on track and out to the new normal, wherever that may be. So I'd like to thank everybody for their efforts so far and pose that challenge. What can you do to help Chautauqua County stay strong and move into phase 2, 3, and 4 openings? Again, continue social distancing, and we will continue to be CHQ strong. I'd like to thank everybody for being here in attendance. Thank you for the media, and have a great afternoon. Thank you, everybody. Thank you.